Hi everyone, this is just a really quick video just to demonstrate how to use our CTG machines. We need to all watch these so that we can tick the box to make sure that we're meeting our Ockenden requirements and to show that everybody's having some CTG equipment training. This is one of the machines that we use at Worthing. It's one of the Team 3 machines. So really simple. Here's your on-off button, just hold it down. At the top here, top left, you've got patient name, ID and gestational age. So we need to enter this in order to use the Dawes-Redman criteria. So the minimum information it needs is just the gestation. So I've just put in 40 weeks. The little lock button at the top will lock the touch screen so nobody else can unlock it. And then there's a code to unlock it, which is 00123 is the manufacturer's default. Then you've got your time and the date, and we need to make sure that they're obviously matching the clock. These empty boxes here, one would be the battery if our machines were able to use battery without being plugged in, but they're not. So just to change the time and date, you just again hold it down and then fill in with what you need to do and then set the time. Obviously here is your the fetal heart rate, and then you've got the TOCO. To manually set it, again you just hold it down to 0. This one here, hold it down, that's for when you've got your BP measurements. You can do this on an auto cycle for the ladies that have got epidurals. You can set it to when you would like it, so every 5 minutes, 10 minutes, 15, 20, etc. And then also it will keep a log of all the other blood pressure monitorings that you've done. And just come out of that. And then in order to set up your Dawes-Redman, you can see it's already down here. So if it's not set up already, then you can press the 2 little cogs, that's the settings, click on analysis settings, and as you can see it might be off, and then you just click Dawes-Redman there, and then that would be set up ready to go. It's important to do that before you press your print button, otherwise you can't do it retrospectively, you'd have to turn it off and restart it again. So to print, hold that one down, and then as you can see it will print off. You can see here that the Dawes-Redman is set up and it's nice and purple. It will take 10 minutes of trace and then you'll get a result. So it might, if it turns green within 10 minutes, then it's met the Dawes-Redman criteria. Our protocol means it needs 20 minutes to meet our guidelines. And then after 10 minutes, you'll get an analysis every 2 minutes. If it goes darker purple, it means it's not yet met the criteria. If you then stop the printer, it will print out your analysis, and it's not for use in labour, it's not for use in the latent phase. It can be used pre-prostin, but not after. And if the Dawes-Redman has not met at 60 minutes, then you need a clinical review. Just going along the buttons at the bottom, this one here, if you hold it down, will print out your paper faster. Click that one, it takes you to the graph view. And then you've got your volume buttons, your Dawes-Redman, and then this little pencil here is so you can annotate the CTG without actually writing on it. We kind of need to get out of the practice of writing on there, although it's nice and easy to do. Instead we need to be using these. So for example, if you change the lady's position, you've got all the different ones here. And then back to settings, and then there's your alarm button, obviously because we're not picking up the fetal heart. So just to silence that, you can hold that down. You've got trace offset here for twins, so you can do it 20, and then if you had triplets, but this machine won't do triplets, but yeah, 20 beats per minute there, that'll do your offset for you. And then just to give you a little squish around the side, you've got your SATS probe and blood pressure cuff probes that will hold that. Turning around to the back, you've obviously got your power lead, this one for the central monitoring, and then this one has got the telemetry attached to it as well. And we also have your fetal event marker. Okay. And then you've got 2 ports at the back that we don't need to use. That is all just for the manufacturers if they need it. And I think that's it.